Hi, and welcome back to the Kid Fix. I'm Dr. Ahmed Erakat, Dr. Cat for short, and this is the case of the week. I was called to the ER to evaluate a 10-year-old boy with about 1.5 weeks of fatigue, difficulty opening up his eyes, and sensitivity to light. He also complained of double vision and blurry vision. His mom thought it was seasonal allergies and had been using Benadryl as needed, with not much relief. The night before he came to the ER, during an outdoor walk, Mom noticed that he was unsteady and he had to hold her hand to keep himself steady, which was unusual. His symptoms had been worsening, so Mom called the nurse, and the nurse said he should go to the ER. On review of systems, he denied fever, denied headache, denied any cough or cold. His past medical history included failure to thrive, so not growing like we want on the growth curve. And he was receiving ongoing occupational therapy for swallowing and sensitivity to certain textures. He was short for his age and had a history of vitamin D deficiency and was prescribed vitamin D. He's never had surgery before. He had a pretty unremarkable social history, several siblings, and he lived at home with mom and dad. Family history of rheumatoid arthritis. Only medications that he was taking was Benadryl as needed, and although he was prescribed vitamin D, he was not taking it. He had no known allergies. On exam, he had normal vital signs. That means normal temperature, normal heart rate, normal blood pressure, and normal respiratory rate. He was in no acute distress, his eyes were closed, and he was in a wheelchair at first, and then he moved on his own from the wheelchair to the bed. Had a normal head. His eyelids were closed at baseline. He could lift his eyelids a little bit, but it took a lot of effort just to get them open halfway. His pupils were equal round reactive to light. The conjunctiva, which is the white part of our eyes, was clear. It was too hard to check his eye muscles because he couldn't keep his eyes open long enough for us to do that. And when I tried to physically open his eyes with my fingers, he started crying and pushed me away. He had a little bit of crested rhinorrhea, so some mucus at his nose, but normal mouth and throat. What was really surprising on his exam was his tooth decay. His teeth were just really decayed. His lungs were clear, heart was regular, without murmur, his abdomen was soft. His neurologic exam, he had normal reflexes in upper and lower extremities, but his grip strength was weak. And I couldn't tell if he was just barely trying or if he was actually weak, but he had full range of motion in upper and lower extremities. And on his back, he had this erythematous macular rash, so a red, kind of flat, dotted rash on his upper back. Some basic labs on him to begin with, so a complete blood count was actually normal. His chemistry, which is his electrolytes, were all normal. He was COVID negative. His inflammatory labs were normal. We did a liver labs, they were normal. We did a CT head, so CT scan of his brain, it was normal. We did an EKG, which was normal. So ultimately, we consulted peds neurology and ophthalmology, and one of them helped us make the diagnosis. Guess in the comments what you think. Make sure to like, follow, subscribe, and share, and I'll have the answer coming up in a few days.